Hello, my name is Kelly Hartzell, and here is Task 2, the presentation for course C132. And I will be doing a presentation on the benefits of pediatric chiropractic for infants. Now, does nonstop crying have you feeling frustrated and exhausted? And is your commitment to exclusive breastfeeding becoming increasingly difficult to keep? Well, there's good news. There is a safe, natural, very effective way to help you and your baby overcome these trying times. Research suggests that pediatric chiropractic is beneficial to infants because it can help them overcome breastfeeding issues and can help them get over the common diagnosis of colic. Now, breastfeeding issues may be caused from a spinal misalignment that may have occurred during pregnancy or during the birth process, as reported by Shaw in 2014. If there's a disruption in the brain element or the connection in the brain that deals with the suck and swallow reflex, it can cause your baby to have a side preference or a latch issue. And seeing a pediatric chiropractor can help your baby overcome that spinal misalignment that occurred. As you can imagine, during the birth process, it can be very traumatic for an infant, and if their head is just cocked to one side a little bit, or they're not coming out straight and aligned, then a spinal those vertebrae in the baby's spine can become misaligned and cause problems early on. Now, in a clinical case series done by Miller, which was published in the Journal of Manipulative and Physiological Therapeutics in 2009, took 114 patients, 12 weeks and younger, and put them through some chiropractic treatments. And after about 4 treatments, the babies, the result was these babies in the darker area were able to exclusively breastfeed after seeing a pediatric chiropractor. And there was, of course, in the other portion, there's little to no feedback or improvement in those other babies. This was also referenced by Shaw in 2014. Now, as far as colic goes, the crying, the lack of sleep can, definitely make it difficult for both parent and baby to get through this and have adequate sleep. However, pediatric chiropractic has been shown to improve this as well. In a single-blinded study done by Browning and reported in an article by Hewitt in 2010, parents were asked to keep a cry journal, and those babies that had received chiropractic care were shown to have significant less crying time and more sleep time, and generally be happier babies. So, parents are often taking their newborn infants to see a pediatric chiropractor very soon after birth in order to be proactive and, hopefully not run into issues with breastfeeding and with colic. Now, you may be concerned about how a pediatric chiropractor is qualified or how they adjust a baby's spine as compared to an adult spine. Pediatric chiropractors are highly specialized and take ongoing training to make sure that they can adjust a baby's or child's spine the correct way, since those spines are still growing, as where an adult's is not. They do not use manual manipulation in fear, not necessarily in fear of, but there is an instrument called an activator that pediatric chiropractors use, where they can adjust the pressure that is given to the baby's spine, because it doesn't take much pressure at all for a baby's spine to adjust. And a pediatric chiropractor, this is the activator that they use. And like I said, the pressure for the thump can be adjusted, and to be very minor to maybe a little bit more pressure depending on the spinal misalignment, and how much needs to be adjusted. Now, pediatric chiropractic is a growing form of treatment with new parents as parents go more towards, natural homeopathic treatment for their kids. And it's proven to be a safe and natural treatment for several issues, including breastfeeding problems and colic. I thank you for your time, and this has been my presentation on the benefits of pediatric chiropractic for newborn infants. Thank you.